Welcome back to Living East Tennessee. Well, for a vascular surgeon, it's one of the worst case scenarios you can hear, being called to an emergency room in the middle of the night about a ruptured abdominal aortic aneurysm. And here to explain more is Premier Surgical Vascular and Vein Center in Knoxville, Dr. Gusev. Thank you so much for joining us.
Sure, no problem. It's my pleasure.
So talk a little bit about this condition and what it actually is.
Well, actually, let's just start with a quick scenario. Your grandpa or father comes, home. Either he's having a breakfast or dinner, develops a belly pain, and the pain gets worse. First, you're thinking maybe upset stomach, maybe something with the food, but the pain is continuing to increase, and suddenly you maybe feel it in the back. And he's getting weaker. So eventually you feel alarmed. You call emergency services. He arrives in the hospital. They do necessary scans and labs, and the blood pressure may be low at this point. And the physician comes out and says, hey, you have a ruptured abdominal aneurysm. So what is this, right? Yeah. It's a really great question. The aneurysm of the aorta is the biggest vessel in our abdomen that sends the blood everywhere, essentially. And the aneurysm is the abnormal stretching and the growth of the wall. And this is where bigger is not better. Right. As the wall grows, it becomes thinner and it is more prone to rupture. So rupture is when this weakened aorta has a hole in it and you're bleeding.
Wow, yeah. That's incredible. And I've heard so many stories like this, especially with the holidays happening, of families being around being like, I don't know what to do. So what happens when something like that happens to someone or a patient?
Well, you are in a life-threatening emergency at this point. So if you're at a smaller hospital, you'll see a lot of commotion. People will be hanging blood. They will be trying to send you over to a bigger hospital where repair can be made. We work at these two big hospitals in Knoxville, along with University of Tennessee, Fort Sanders, and Park West. Can handle these repairs, and then they will be calling me. So I will be showing up to your bedside and talking about a ruptured aneurysm and how we can repair it. Nowadays, we repair this with endovascular approach, and here, if you zoom in here, we basically, most often, if the anatomy allows for it, go inside your aorta and try to deploy a stent, which is basically a fabric-covered spring, and it should cover the hole, cover the weakened part of the aorta, and stop the bleeding. Yeah. Now, if the anatomy is not amenable for this repair, we have to go open, which requires a big cut and very bloody surgery.
Absolutely. And who is at risk for developing something like this?
People who, women and men who are elderly and who are smokers with uncontrolled blood pressure are at risk.
So that's a treatment option. How long does that land you in the hospital if something like this happens to you?
Well, if this is an emergent repair, 50% of the people don't make it to the hospital, they die. And then in the hospital, it's a coin flip. It's 50% make it and 50% don't make it. Wow. And it's a prolonged hospital stay. Even after the repair is quick, there is so much damage to control afterwards.
And what are the symptoms for something like this for people watching at home to watch out for?
I don't want to be an alarmist or create false anxiety, but if you are a person at risk, elderly, smoker, uncontrolled blood pressure, and you develop an abdominal pain or groin pain that's going to the buttocks or the back, and if this pain is intensifying, I think I would, at this point, have this across your mind and something to seek attention for.
And one last thing, where can people find you guys? Something like this is so serious, it's important to have your information in particular, just in case anything happens.
People can definitely find us at Premier Surgical Associates, but usually if you fall into this category, 65 to 75 and a smoker, a one-time abdominal ultrasound should be enough to screen you for this condition, and a planned repair has much better outcomes and much less morbidity.
Well, thank you so much for joining us and sharing that knowledge and information. I know it's definitely going to help someone out there for sure, Doctor. Thank you so much.
No problem. My pleasure.
Well, stick around, guys.